Welcome everyone to our June meeting. I am really thrilled and delighted to share with you what's going on. I'm feeling super energized and very optimistic that we can get this bill to the finish line in 2024. Those who are sick on dialysis are depending on us to get this bill to the finish line. And we are the healthy people who have voices and energy to get this bill passed. So as usual, I'll update you about our progress. Then we're going to go into breakout rooms and then have an open discussion. So to remind everyone, or for those who are new, we're aiming to pass the End Kidney Deaths Act, a 10-year pilot program that by the 10th year we expect will save between 60,000 and 100,000 American lives. And we will also save the taxpayers between $14 and $25 billion. This is a unique opportunity to save both lives and money. Our plan is to provide for all Americans who donate kidneys to strangers a $10,000 refundable tax credit for 5 years. So for $50,000 total, they will get incentivized to save the lives of those who are dying on the wait list, those who have been waiting the longest on the wait list. I see this as a way for the healthy among us to be engaged in tireless advocacy to save the lives of those who are not healthy. Now, I'm going to just share with you an experience I had last week. I was at a concert and the singer said, we have 10,000 people in this audience. And I realized that's how many people we can save annually with the End Kidney Deaths Act. So I began to just stare at the crowd, and I was emotionally overwhelmed to see what 10,000 people looked like. So I took a video of it to give you a sense for how many people will be saved in just 1 year of the End Kidney Deaths Act. And we can just picture, along with each person that we're seeing, their family, their friends, their communities, what relief and comfort it will provide to thousands and thousands of Americans. I am so excited to get this bill passed. So how many meetings have we had so far since January 3rd? We've met with 80 House representatives and 54 senators. We had 2 meetings today. We are meeting with people nearly every day. And the strategy is, let's try to meet with as many congressional leaders as we can, so that once the bill is introduced, we can circle back and ask those people who we've already met with to co-sponsor. The more co-sponsors the bill has, the more likely it will be passed, because when someone co-sponsors, they're indicating that they are in favor of the bill. This is just a list. It's actually a couple names are missing because I added a couple meetings since I made this grid yesterday. But this is all the different representatives we have met with since January 3rd. And the responses we're getting from them are overwhelmingly positive, which is super encouraging. Now, our focus is to find a Republican Senate lead on the bill. And we want that Republican to come from the Senate Finance Committee. So we have met with all but 2 of these members. The 2 that we are missing are Stephen Daines from Montana and John Thune from South Dakota. Unfortunately, we have no committee members in either South Dakota or in Montana. So if you know anyone who lives in either of those states, we'll have a much bigger likelihood of getting a meeting if we have a constituent requesting that meeting. I have requested meetings from them multiple times with no luck. So if you have any connections in South Dakota or Montana, please fill us in, because that will help us get those members at least informed about our bill. Hopefully one of them will be the co-lead on the bill. Media coverage. So the focus right now is local media coverage, because what we found is that politicians are very responsive when there's a local media story. When there's a big media story that's national, it doesn't quite get them feeling that voters are listening. But when it's a local story, I send it to all the members in that area, and we're getting good responses from them. So this month we had good articles and coverage in different places, from radio to television to print. Now, one of them that I included in here is the Pensacola News Journal. That was something that was a letter to the editor written by, oops, it's not here. Oh yeah, here it is. Megan Sherrod. She wrote an article that, I'm sorry, she initially wrote an article for her local paper. They didn't take it as an op-ed, so she submitted it as a shortened version. In the shortened version as a letter to the editor, it was printed. So please feel free to write to your local newspapers, get in touch with your local reporters. This is a great way for us to get more congressional support. Now, I had the good fortune of attending the American Transplant Congress, and I actually need to thank all of you because that the money raised to send the team to the American Transplant Congress came from donors. We will need some donations to get ready for our lobbying day. Once the bill is introduced, we're going to all meet in Washington, D.C., and we will need some funding for that. So if you are interested in donating, it turns out we do need some funding to make these trips. And so at the American Transplant Congress in Philadelphia, it was an excellent time for us all to meet new allies and wear our t-shirts that say "Pass the End Kidney Deaths" on them, pass the End Kidney Deaths Act on the t-shirts. On the left, you can see our founding team. We have from the left to right, Matthew Harmony, he's an ER doctor and a non-directed donor. Next to him is Gregory Hess, a kidney recipient and also an ER and ICU doctor who has attended congressional meetings with me, as well as Matthew Harmony. Next is Cody Maynard, non-directed donor, very active in helping us get everything together, especially on the tech side. There we've got Brian Temple, who is a kidney recipient, who's been also very good in helping us with anything that has to do with messaging. To the right after me is Diane Hall. She is a fantastic news reporter who knows just a ton about getting good media attention. Ned Brooks to the right of him. Not pictured is Mike Lalo, who's on the call. On the right side, we have, we call them the Three Musketeers. Those are the three medical doctors who have attended many congressional meetings with me. The one I haven't mentioned yet is Thomas Peters, an eminent transplant surgeon. So while we were there, at every conference, at every presentation that I attended, I asked a question. And this question is a long question, and it was really a way to publicize information about our bill. Most of this stuff you already know, but I do want to mention that I told everyone who was listening that Al Gore said 40 years ago that tax credits are very much needed. For if we hit a shortage of living donors, as well as the American Medical Association's approval and encouragement of getting a pilot study done to find out the impact of compensation on the kidney donation rate. So altogether, I was able to ask this question many times and publicize information about our bill. As a result, I had a lot of great conversations with medical professionals. They have huge amounts of interest in our bill. So I've attended now 3 transplant congresses and conferences in the last 2 years. And when asked about how to solve the kidney shortage, medical professionals come up with 2 ideas. The first one is that we should fully reimburse donors for their costs and lost wages. I think that's excellent. However, that's already being done. Most donors are receiving reimbursements for their costs and lost wages, and yet we have had no subsequent increase in the number of kidney donors. In fact, in the last 25 years, we've had no increase, despite the fact that most donors are getting reimbursed. So that's not the solution. The second one is preventative health. Let's teach patients about healthy living so that they never develop kidney failure in the first place. Well, that policy proposal is failing. We have, as we all know, 800,000 people with kidney failure. That number is going to 1 million by 2030. So preventative health strategies are not useful, certainly in increasing the number of living donors. And in fact, the problem is getting worse as the wait list is getting longer with so many people developing kidney failure. So I learned a few things I want to share with you at the American Transplant Congress. One of them is that in the past 13 years, over 100,000 Americans have died while on the kidney wait list. That hospitals make no money from deceased donation. However, hospitals do make money from living donation, so that when we increase the number of living donations, we're going to be really helping out hospitals' bottom lines. So we're helping the taxpayer, the recipient, the donor, and now we know we're helping the hospitals have better economic success. And the last thing is, and I think I heard this before the conference, but I had many conversations about it there, and that is that the xenotransplant kidneys are going to be a dialysis substitute short-term, not a human kidney substitute. People will get a pig kidney until they can get a human kidney. Human kidneys will remain, as far as we know, the gold standard for kidney care. One interesting thing that I came across this past month is that they're considering at the Mayo Clinic of expanding the donor pool to those with type 2 diabetes. And I think this just speaks to the desperation, because type 2 diabetes is the biggest driver of kidney failure. I'm not really sure what they're thinking in taking kidneys from people with type 2 diabetes, but this is something that demonstrates the desperation of due to the kidney shortage, which will hopefully be ended with the passage of the End Kidney Deaths Act. Another thing that was interesting is that fewer and fewer doctors are interested in becoming transplant surgeons, and that is something very concerning. And I'm hoping that with the passage of the End Kidney Deaths Act, with the increased number of kidney transplants, that hopefully more will be attracted to the field. Now, the End Kidney Deaths Act was very fortunately featured in 4 different presentations during the American Transplant Congress. The first time it was in a debate about, is it time to allow financial incentives for living organ donation, which was really interesting. Here's a slide that was from a public policy talk, and they were talking about incentivizing donors. And these are different thoughts. If incentives improve donors' likelihood, that's a good thing. If they exacerbate existing inequities in society, that is a bad thing. Now, there's no chance it would exacerbate existing inequities. Instead, the people who are going to be disproportionately helped with the End Kidney Deaths Act passage are those who are have low levels of education and live in rural areas. This will actually help people who are the most vulnerable in their society. They're the people most likely to die from the kidney shortage currently. And if incentives expand donors' choices for how to order their lives, that's a good thing. This provides donors with autonomy. What is fair? We don't need incentives to increase access to transplants. Other programs with fewer downsides could be just as good. Well, I just reviewed for you that their programs are incentivizing, educating about preventative health, not working, reimbursing donors, again, it's not working to increase the number of living kidney donors. Organ donation motivated by an incentive program has a low chance of harming the donor's health. Well, that's true because we know that donors live longer than the general population, but the benefits to the donor in terms of livelihood and to recipients in society are great enough to justify that risk. We know that the transplant centers are not taking chances with donor candidates. They're very conservative in their appraisal of who qualifies, and they will continue to do so after the passage of the End Kidney Deaths Act. Telling potential donors that they shouldn't be motivated by incentives denies their fundamental right to self-determination. That is one argument in favor by a doctor during the conference. Here's another presentation that I attended. This one mentioned us on a slide, and you can see the article from the LA Times written by Ned Brooks and Matt Kavanaugh, which really launched the whole movement. This is interesting in that there's a decreasing number of young low-risk donors. The quality of donations is not as good as it previously was, and that is something to be concerned about, and will again be helped by the passage of the End Kidney Deaths Act, where we will have thousands of healthy Americans stepping forward to save the lives of strangers. This is where I found out that deceased donor kidney transplant is at best a break-even business and usually results in a financial loss for a hospital. That is concerning. And so upping the number of living kidney transplants will be very helpful for hospitals' bottom lines. Here's another presentation that included information about the End Kidney Deaths Act. And this was a bit strange. Their solution in this presentation was to transplant waitlist candidates more quickly. Well, with a shortage of kidneys, that's not a possibility. Again, this slide indicated to me we cannot pass the End Kidney Deaths Act too soon. This needs to get to the finish line ASAP. So a question that I received several times from community members this month is one that I just want to clarify for everyone. And that is, why are we not offering this tax credit to all people who donate to kidneys? Why are we doing this only to people who are giving kidneys to strangers, for people who are only giving kidneys to strangers? It is because it's easier to pass this way, and it's also a pilot program. It's a big change for our country to compensate donors. And so we are doing it in a smaller test case, and we expect it's going to be such a success that this tax credit will be offered to all donors after a certain period of time where we prove our point and show that we are saving lives and saving billions of tax dollars. Now for some good news. Kathy was with Sean. These are both community members at an event on Saturday night in Georgia. It was Friday night. And on Saturday, Sean got the call that he would be receiving a kidney transplant. On Sunday, Sean got a kidney. I've been in touch with him. He's feeling better and better. And he's already introduced me to new people to join our team. I am absolutely thrilled for Sean. He told me, we were on a congressional call last week, that his father died on the wait list and both of his grandparents died on the wait list. So he has a 13-year-old son and was very, very distressed about his worsening condition. I couldn't be happier that he is now transplanted and recovering beautifully. And Kathy sent me this picture. Thank you, Kathy. The next piece of good news is that another community member who's on this call right now, Mark McIntosh, is receiving a kidney tomorrow. I can't tell you the amount of excitement I feel. It's just such a happy thing to go from deep levels of sickness to great health with a kidney transplant. To the right of him is Jessica Coleman. She's the transplant coordinator in Colorado and just at Porter. Just so thrilled for Mark and his family that he's going to be well again very shortly. We have a whole bunch of new flyers. They're very good looking. They're two-sided. We were passing them out during the American Transplant Congress, and we have extras. So if you would like some flyers, please email me your address and how many you want. I will send them off. So this is a really important slide. The End Kidney Deaths Act, will it harm low-income people? In fact, as I said earlier, the End Kidney Deaths Act will increase donations for low-income people. There will be an abundance of transplantable kidneys that will disproportionately help those who are low income and living in rural areas. Those people most likely to die from the kidney shortage. Right now, low-income people face financial barriers to donate. In fact, most donors are middle and high income. And it's because donation costs money, and a lot of the programs do not reimburse you until after you've donated. And so you have to front the costs unless you're going through the federal program. And so the third thing is it's very morally important to compensate people for difficult work. And as we've said earlier, donation is work. It's time consuming, it's painful, and it's stressful. And it's unjust that donors are unpaid for the stressful, time consuming, and physically uncomfortable experience of being a kidney donor. Because of the value they provide, we compensate people for difficult jobs in surrogacy that are far riskier than kidney donation. So we are overdue in compensating kidney donors. In my next email that I share with you, we're going to be, I'll be sharing the phone talking points. So if you want to make calls to your congressional leaders, that will be a guide for you. We've also updated the End Kidney Deaths Act summary that we share with congressional members that now includes that the American Medical Association supports pilot programs for compensation, as well as Al Gore's quote that right from the beginning, we were, if we experienced a shortage, we should start providing tax credits for kidney donors. I'm also asking you, if you have time and energy, if you could just take a look at our website and provide some feedback. It is a website that is ever changing and updated, but if you have time and you can think of ways that it could be better, I would be very grateful. Also, if you need any support with social media posting, you can always share what we post on Twitter, Instagram, and Facebook. And you can develop your own posts or you can share ours, but social media is a great way to get more community members. In fact, the media articles have been very effective at building up our community. Every time we get exposure in the media, we get new members signing up to join us in our persuasion campaign. I'm also going to share with you an article by Dr. Mattis. He was the person who debated in favor of compensation. For decades, he has been in favor of compensation. He's a transplant surgeon. Dr. Mattis's article from 2021 was key in persuading a lot of medical professionals to be in favor of compensation. I spoke to more than one doctor who told me that they changed their minds on compensation due to that article. So I just think it's a good article for you to all have and perhaps share with others, especially those in the medical field. It is very persuasive. It was published in JAMA Surgery. And the last thing is very excited for our July 9th meeting. And that is our next meeting on Tuesday, July 9th, 5 p.m. Eastern time, hopefully with more good news to share.